So this is to show you that the aligners, I'm going to go, the aligners, when they are 3D printed, you can see really that they are going right into the interproximal space. They have much better adaptation to the dentition. And all these, I would say, extra material will help you correct and rotate teeth much better. You have a better handle on the dentition, and you don't need to use so many attachments. This is the difference. If you look at, this is not a great picture, but just to show you that at this level, the engagement of the aligners are not very strong because it's a thermoform aligner, and they have, because you need to be engaging the plastic has to go over the teeth, and obviously because the thermoform material is much rigid, you cannot really engage these undercuts, so you're losing a lot of potential engagement, and you lose a lot of the potential force distribution. So this is the main difference. A lot of people say, well, if I use 3D printed, I will get into a better setup because I will avoid printing models, which is true. But the big advantage is, at my opinion, is at the distribution of the stress on the dentition, where you will get a much better, call it moment to force ratio or whatever. So you can get torque control, you can get rotational control that the other materials will give you if you use a lot of attachments. Sorry. So the second point, as I just said, is to enhance the application of desired force system. So the problem you have is, we all know that when you do simple orthodontics, you get into a, if you push the dentition, I was in Invisalign since 1998, I worked with it, and when you had a case where all you had to do is push, you were getting very good results, because it's a simple movement. But if you wanted to torque the dentition, which is the reverse of the push, then it was very complicated, because you needed a very high moment to force ratio to be able to get the root to move where it wants to go. So this is very, is it gonna work? Yeah, so you can see that if you go like this, which is uncontrolled tipping, so the aligner, any type of aligner can do that easily. Then if you go to controlled tipping, you're pushing the standard rotation at the apex. You need a little bit more moment to force ratio. If you want to translate, you need a bit more again, 10 to 12. This is more complicated with aligners. And if you want root movement, the moment to force ratio is 18, which becomes very complicated. So this is why you need to have a material that has the capacity to give you this type of moment. If you need extrusion, same concept. If you push the tooth, it will rotate and definitely extrude. You'll have some control, but again, with some aligners, you may want to add a second force. Is that working still? Yeah. You have to do a second force. So this way you'll get a much better extrusive moment that you can decide which one you want. So all these materials that are adapting really nicely will give you the potential to get better and more controlled tooth movement. So that's the idea behind using the new generation of materials to give you these types of treatment. So remember that attachments are used with any type of, I would say, aligner treatment. They are a good addition because they give you the capacity to add a force couple, which means that you're rotating, you're pushing the tooth, but you're also rotating, and you get the movement you want. Working? So this is basically in better explanation. If you are using, is it coming? Yeah. This right here, sorry, I don't have enough quality. Okay. So if you look at here, this is basically what we all want to do when you want to retract a canine. You need to be able to push on the crown, and because you push on the crown, you will generate tipping. So that's why some smart people invented the attachments where you get a counter moment and then you get pure translation. With the concept of 3D active polymers, you'll be able to engage this crown much better, get into the undercuts, and you may be able to reduce the size of the attachments, and in some cases also reduce, I would say, the volume necessary or the number of attachments that you will be using. So basically you want this force to be pushed at the center of resistance to get translation, which is hard to do with the liners. But the new materials should be able to help us achieve the concept. A little trick I can give you, basically, is if you want to do canine retraction, one way to help the retraction is to open up in the Titan software or whichever software you want to use. You open up 0.5 millimeter space, and then the material, the active polymer from LuxCreo as an example, will be able to engage all the undercuts, and you will get a much better movement. At the moment, if you push it, the attachments, if you push it with a thermoform polymer, what happens is it will still not get in between the teeth. So you're losing a lot of the advantage you would get by using the concept of having shape memory or active memory polymers. Is it working? Yeah, so I don't know if I got a movie on this side. Yeah, that is the movie. Okay. So what happens, I took this example of a case where you need to be closing the spaces and doing some movements, and you can see now that again you have these areas in red that are very complicated for the thermoform polymers to engage, and you have to block these, I would say block these undercuts if you want the aligner to be engaged in all the dentition and be comfortable for the patient. So you're losing a lot of rotational power, a lot of expression of force coupled, that with a polymer that is 3D printed will give you a much better, I would say, idea. Sorry. Let's play again. So I'm just showing you this movie too, just to show you how it works. So that's a case that we did, I got from LuxCreo. It's basically a simple case, but just to show you that with 10 aligners, without any attachments, we did a bit of expansion in the canine area, and slowly the occlusion after 10 aligners was not corrected fully, but it's almost on this very good way, and it was a very predictable movement. Why? Because the polymer or the aligner was able to engage all the little undercuts and give you much better control. No, maybe? Okay, so this is the image, the before and after. So we have the before, now we have it's not, the case is not finished, but it's only 10 out of 20. So the case is supposed to be taken 20 aligners. At 10 aligners, you already see a significant improvement without any attachment. Granted, there is no significant rotations. It's still a fairly simple case, but at the end of the day, you can see that the treatment was pretty predictable and worked pretty nicely. Something else I wanted to talk about a little bit is the constant refinement system. So the problem we're having with the aligners is slowly but surely you're losing a little bit of, I would say, every time you put one aligner, you lose a little bit of precision, and by 5 or 6 or 7 or 8, you are completely losing traction sometimes with very complicated treatment. So what you can do, you can either monitor with the patient coming to the office, or you can decide to basically, basically have dental monitoring or whatever to any company that will give you the opportunity to monitor the treatment as it goes, okay? So what we suggest to do is to print 8 to 10 aligners. You monitor the patient, you verify that everything is going how it's supposed to go. If it's going well, you print another set of aligners. If you don't really see or don't like what you see, you have the opportunity to change and really go towards a refinement or a mid-course correction. Okay, so that's basically the concept. You get the patient, you stage the treatment, you deliver the aligner, you tell the patient either to use dental monitoring or some other form of monitoring, or you have a clinic visit every 8 weeks. You reassess, you print, either you tell the patient, well, I'm going to print you another set using LuxCreo DPA or DPA Plus, you assess again, or you can make a new scan, do a refinement, or continue, and then you have a new set of aligners. So either way, the only massive difference or big difference is here, if you don't like what the aligners are doing, or you think that you could correct the malocclusion in a more predictable way, what you can do is just do a new scan and just do a refinement. That's why I think the concept is good, because it avoids printing too many aligners for no reason, throw them out, so you can definitely get a full control of the treatment by using this type of system. So why are we using active memory polymers, except for the fact of 3D direct printed polymers? Because except for the fact you're saving models, which is fine, the big thing for me is you're engaging undercuts, which means that you will have a very tight fit between the aligner and the dentation, which allows for the force system to be expressed in a much better and much more predictable way than you would have if you had thermoform. One characteristics of shape memory or shape recovery is the aligner is deformed, as we all know, and you put it into a hot environment, like LuxCreo has this little cute machine that you can clean your aligners and heat up the aligner. So what it does, it makes the aligner material softer. So the material is softer, you can insert it into the patient's mouth much easier, or the patient can do it himself or herself. And slowly, it's called a phenomenon, it's called shape recovery. The material will come back slowly to its original shape, delivering light in continuous forces. And for the ones who have been working in orthodontics as long as I have, it gives you the same effect almost as nickel titanium. Normally, you should get a much more precise fit, as we said, and it's been proven by the literature that the fit of shape memory or active memory polymers is much more precise, and you get the need for much less attachments. So that should be a plus. You don't have so many attachments. That reduces gel time. It gives you the same amount of tooth movement that is needed, and you can get printable in any configuration. What do I mean by that? Well, you can make the trim line longer. You can make the areas of the aligner thicker. You can do a lot of good things with the system once the software that you'll be using, the Titan, Archform, ULabs, will be optimized. So you'll have calculations, and what I'm always saying is aligners are known to be displacement driven. So you move the tooth on the software, and the aligner is supposed to take the tooth and move it. I think with the new generation, we're going to get into a better concept which is called force driven, which is the same as conventional orthodontics. You will calculate the force, and the aligner will say, well, to get this force system delivered, you will need a thicker place here, you will need to do this, and the software will be much more, I would say, sophisticated than just a thermoform aligner. So that's, to me, that's the future. But again, companies like LuxCreo and Titan will have to work together, or ULabs, to get into this new world of fully customizable aligners. That's the future, or it's maybe even there, I don't know, but it's coming very quickly. So this is another small movie that I got from a part of a movie from the engineer at LuxCreo, so you can put the appliance or the aligner into hot water. You can see that it's become very, very flexible. So it's shape recovery. It's not really shape memory. And that's a different discussion. So you have a very good shape. You have a very shape recovery. You can press the aligner. Everything comes back to its original shape. And the big advantage is you have a delivery of force that is, one is force, the other one is force couple. And with this aligner type, you get both in a much more predictable way. So this is exactly what Mr. Harizu proved in a paper that we have submitted, that you can get almost 99% recovery of the shape when you are using LuxCreo material, if you get to 0.05, which is a very small tolerance. So they are very precise materials. You get a lot of force recovery, almost the whole force. Like the worst one is 89, being at the 0.1 tolerance. This one is 0.05, which is super tiny. So if you look at 0.1, which is where we work in orthodontics, the worst one we get is 89% force recovery, which is pretty close to being almost 100%. So, and then just to show you how it works, I took the same case as before, that to show you that we can pretty much close spaces. You can see there is only one attachment in the middle there. And what happened is we started the pre-treatment with a space of 4 millimeters or something. Yeah. And then what happened is the space was 4 millimeters. We didn't use attachments. We brought the teeth together and together. And the space after 12 trays became 2.84. And you say, well, okay, is that good or bad? Well, it depends on the software, because if you look at after 12 trays of space closure, you close 1.2 millimeters, which is 0.1, not a much. But we could have probably done more because the virtual treatment was 2.78. So basically the software that we used was very conservative. It moved the teeth very slowly, 2.7 as I'm showing you here. And the problem was, because we could have probably taken advantage of the shape memory to a higher level and make probably the movement of this premolar and this canine got together to bring them. And you can notice that they stayed into a good, I would say, parallelism. So they didn't tip too much. And probably the orthodontist could have gone to a higher level of movement to make maybe, I don't know, 2 millimeters instead of 2.78. And with the big advantage is the teeth did translate as predicted, almost the same as the prediction. But again, I think that the future will be with those active polymers to go to a higher level of movement. Let's say instead of 0.1, 0.2, 0.3. And all you need to do is to heat up the material before you go for dinner. Insert it back after dinner, brush your teeth, and let the material work at night as the way it's supposed to be done. So what about future development? There are many. The biggest one is to get closer to a force-driven system. Why I'm saying this is the force-driven system allows you to define the force you want, the couple you want, to get the material to be thicker, thinner, as I said before, to get into a much more predictable tooth movement. And again, you must have new software that will, not new, but improved software that will take advantage of the active memory polymers that we offer here, and to be able to really move teeth exactly the way we want in a very predictable manner. And then eventually the last project that we have is to use machine learning to better predict the case selection and to help people make sure that the case you are selecting is within the range of treatment that the aligners can perform. with very good predictability. So that's basically the three most important aspects of what we should be doing. Something else I could show you is, I've been trying this lately. So one of the biggest issues we have with liners is torque. It's actually also true with even conventional orthodontics. So it's hard to do the torque. So what we do, we create virtual power ridges into the dentition. So you have one in the buccal, one in the lingual. Same principle basically as the old power ridges from Invisalign. And what happens is then you look at what is the difference between the two teeth. You make the aligner. So the aligner now is produced with the power ridges inserted into the system. But because you use 3D printed aligners with with memory polymers, they will engage perfectly into these problems and will be able to deliver the right couple, which should be able to give you the exact amount of torque that is actually necessary to torque the dentition. The only problem you may have is to decide what kind of activation you are using. But if you look on the screen, you can see that the force couple has been created. And because the 3D material or the 3D polymer material is very, very soft, it has the capacity to deform and give you the force system necessary to torque the dentition the way you are predicting, which did not happen with the thermal form because their way of dissipating the energy is much, much faster, and you lose the force couple very quickly. So that's the idea of using 3D printed polymers to give you these very interesting engagement and let the material give you the force recovery or stress relaxation we call, so it becomes very predictable. And at the same time, to be frank with you, I don't really know what's the optimum I would say void you have to insert or to create. That would have to be researched correctly. And it's probably also, when you think about it, it has to do with the shape of the tooth. So depending on the size of the tooth, you may want to do either smaller or bigger, I would say, dimples, we call them, to get the best possible activation. So that's something fairly new I'm thinking about, how to compensate and create these force couples and how to be able to get the best possible force system. All right, so anybody has any questions or anything? Thank you, yes.